All right, I want to finish up here with these three, B12 deficiency anemia, folic acid deficiency anemia, and aplastic anemia. So vitamin B12 anemia, okay, well, we need vitamin B12, obviously. Red blood cells need DNA, deoxyribonucleic acid, for synthesis. And DNA requires folic acid, and vitamin B12 activates the enzyme that transports folic acid into the cell where the DNA synthesis occurs, okay? So you can see how I've talked about folic acid yet, but we will in a minute. So they work together to help eventually produce red blood cells. So lack of vitamin B12 obviously inhibits the transport of folic acid into the cell, and so therefore you have decrease in DNA production in the precursor cells. Precursor meaning before the actual formation of the red blood cell. So it's a step that is not accomplished. Fortunately, we'll talk about treatment. It's easy to treat. So these cells under a microscope are macrocytic or megaloblastic. So they're big. They're big fat cells, large, and they're abnormal. And we're talking about red blood cells, always. Results often from poor diet and really a lack of vitamin B12 ingestion. Therefore, do you think we see it much in our country? No, we don't. But we could see it in vegetarians and also folks who have no dairy in their diet. But again, a lot of our foods now are B12 fortified. Other things that could lead to it would be poor absorption of B12 from the gut. For instance, let's say someone had a substantial bowel resection where a large part of their intestine was removed, or they have a diverticular disease in the gut, tapeworm, and overgrowth of intestinal bacteria. Those are just a few that I threw out. As you read your textbook, you'll learn more about what causes B12 anemia. So this anemia resulting from a failure to absorb B12, actually we call it, another name for it, pernicious anemia, also is related to and really caused by reduction in IF, intrinsic factor. So that's key. Intrinsic factor that is secreted by gastric mucosa is really important for the body to absorb B12. Without this, even if you get B12 in your diet, you don't get it into the bloodstream. So, how do we manage it? Well, we can adjust the diet, improve the diet. We can go back, we can say, let's eat more cheese, eggs, milk, more protein, vitamin supplements. In terms of management too, we can do what's called, and your book will refer to it, called the Schilling test. It measures the presence of B12 in the urine following an oral dose of radioactive vitamin B12. So if it's not absorbed because of pernicious anemia or lack of intrinsic factor, it won't show up in your urine because it never reached the bloodstream. It was never going to be broken down by the liver, and it was never going to be processed and then finally eliminated in the urine. So these folks will get B12 injections, and also they'll have to get B12 injections, or there's a nasal spray preparation. So that's B12. Folic acid. Folic acid, very similar, a deficiency of folic acid. So it really works quite along with B12. Let's say folic acid does not affect nerves. It does help. It does help to differentiate folic acid from B12. Let me tell you here the three common causes. Again, what do you think? Poor nutrition. Sometimes malabsorption, which really was one of the reasons for B12 deficiency. People who have Crohn's disease, alcoholism, and drugs. Sometimes drugs, anticonvulsants, oral contraceptives will decrease folic acid. Okay, so you can see that folic acid, it's ubiquitous in our diet, so it's very readily available, but there are certain populations that will require folic acid, especially in pregnant women. And then lastly, let's talk a little bit about aplastic anemia. This is a decrease in red blood cells from the failure of bone marrow to make red blood cells. So we have a problem with the progenitor or pluripotent cells in the bone marrow. So these stem cells, for whatever reason, are altered. This will happen and occurs with leukopenia, a reduction in leukocytes, and also thrombocytopenia, so a reduction in platelets. Essentially, with a failure of bone marrow, you're going to have a pancytopenia, meaning all your blood cells, leukoid and myeloid, those making leukocytes and the various families, and the myeloid cells, red blood cells, and megakaryocytes, platelets, you're going to see a reduction in all those. Now, we call it acquired aplastic anemia. It's the most common, and it can be as a result of a long-term exposure to toxic agents or even drugs, ionizing radiation, or infection. Apparently in 50% of the cases we don't know what the cause is. And really the treatment is transfusions of the specific blood product. And in a nursing assessment, or any assessment for that matter, of these patients, you want to, of course, look for weakness, pallor, petechiae, which are small little blotches on the skin, and ecchymosis they're larger kind of blotches where there's been bleeding occurring. And then there could be some therapy involved in immunosuppressive therapy. Perhaps you have an autoimmune process going on here. A splenectomy, and also sometimes stem cell transplantation. So if you can get some normal stem cells and transplant, that can help to alleviate the bone marrow deficiency. And I haven't told you everything there is to know about these, but it gives you a little bit of a window into some of these anemias. Okay, good luck.